Hi there, and welcome to the Gestational Diabetes Education class recording. My name is Dervla. I'm one of the dietitians here in the Rotunda Hospital, and I will be taking the recording session today. So, thank you all for joining me. Just some basic housekeeping rules, I suppose. Maybe make yourself comfortable. Do know that this recording will last roughly 1 hour, and if you're using a phone or a tablet to watch the class, it might be helpful to turn your device landscape or sideways so that you can see the slides better. And then also just know that this is a recording session of the class. So with that, we're going to get started. So what will we cover today? So today I'm going to talk you through what is gestational diabetes, why does it matter, management, so how can we manage our gestational diabetes by making careful food choices and potentially doing some physical activity and looking at other supports that are available to you as well. Then in the second half of the session, I'm going to talk about how to monitor your blood glucose levels, your diabetes care during pregnancy, and then what happens after your baby is born. So, whenever someone is diagnosed with gestational diabetes, the most common question that they ask us is why me or why did I get gestational diabetes? The first thing we always explain is it's really important to know that there's nothing that you did wrong that caused gestational diabetes. It's really important to know that it's not your fault. There's nothing that you did wrong that would have caused it. There are certain risk factors that could put you at higher chances of getting it, for example, for age or ethnicity or a family history of diabetes. Those things could put you at higher chances of getting gestational diabetes over another woman, for example. But you might be wondering, well, what actually is causing the gestational diabetes then? So, what's actually causing the gestational diabetes is the pregnancy hormones in your body. So, if we think before you got pregnant, there was no diabetes, okay? And then whenever you got pregnant, you got gestational diabetes. So, what's happening there is whenever you were not pregnant, there's no pregnancy hormones in your body, no diabetes. Whenever you got pregnant, there's lots of pregnancy hormones circulating around in your body, from coming from the placenta and coming from the baby, and those pregnancy hormones are causing the gestational diabetes. You might wonder how are they doing that though? So you may have heard of this hormone called insulin before. So insulin is really important because it controls and regulates our blood glucose levels and keeps them in perfect check. But whenever we get pregnant and those pregnancy hormones are in our body, those pregnancy hormones can fight against insulin, and therefore the insulin can't do its job properly controlling the blood glucose levels, and therefore the blood glucose levels can go high, and that's known as gestational diabetes when that happens during pregnancy. Um, I just want to highlight because lots of women ask maybe is did what I eat or drink in the days or weeks before my glucose tolerance test that cause the gestational diabetes? And the answer is no, that wouldn't have caused the gestational diabetes. It's the pregnancy hormones in your body that are causing the gestational diabetes. I'm going to show you a video clip next just to explain a little bit more about gestational diabetes and what's happening in your body.
Food and drinks are broken down in your digestive system. The sugar they contain is absorbed into your bloodstream. But sugar needs insulin to work. Insulin is made by the pancreas and helps sugar get into your cells. Insulin acts like a key that lets the sugar move from the bloodstream into the cells of your body where it is used for energy. Pregnancy hormones change the way insulin works in your body. In the later stages of pregnancy, these changes make it difficult for insulin to unlock the cells and allow the sugar to enter. This is what is known as insulin resistance. Some insulin resistance is normal in pregnancy, but this means that your pancreas needs to work extra hard to keep blood sugar levels in a healthy range. When you have gestational diabetes, your pancreas is not able to keep up. As a result, too much sugar is left in the blood.
And when too much sugar is in the blood, that is known as high blood glucose levels, which is known as gestational diabetes whenever that happens in pregnancy. Just in case you've heard me change between the terms blood sugar and blood glucose, they both mean the same thing whenever we're talking about gestational diabetes. So your blood glucose levels or your blood sugar levels, the terminology it means the same thing. So what I wanted to show you next then is lots of women get diagnosed with gestational diabetes in pregnancy. It's a really common condition in pregnancy. but it is super important that you manage it as well. So what we're going to look at is the feelings that came up for women whenever they were diagnosed with gestational diabetes. So at diagnosis, many women felt worried, shocked, upset, disappointed, surprised, really anxious or confused about their diagnosis with gestational diabetes. So maybe even you can think about what feelings came up for you whenever you were diagnosed with gestational diabetes. Then weeks after diagnosis, lots of women felt supported, they feel grand, they felt used to it, they felt that they had a better understanding of it all. However, some women still find that it's tough or that they're anxious. And then after delivery of baby, many women feel relieved, supported, maybe I'm glad it's over, potentially more informed or health conscious for the future, because we do know gestational diabetes can put you at higher risk of developing type 2 diabetes in the future as well. We'll talk more about that at the end of today's session. I suppose what I wanted to show you here was the whole range of emotions that you may feel in your pregnancy with gestational diabetes. And I suppose this was a really large study done with lots of women with gestational diabetes, and it just shows their feelings and emotions that they experience throughout their pregnancy with gestational diabetes. So you might be wondering, well, why is it important to manage my gestational diabetes? So what we know and what the evidence shows is that good management of your gestational diabetes greatly reduces the risk of health problems for you and for your baby. However, if you have high blood glucose levels, so persistently high blood glucose levels during pregnancy, that may lead to potential harm for mum and potential harm for baby. The potential harm for mum could be things like preeclampsia, so that's a serious condition in pregnancy with high blood pressure and protein in your urine, or urinary tract infections or early birth of baby. Or if mum has high blood glucose levels during pregnancy, the potential harm that could pose for baby or health problems that could pose for baby would be macrosomia, so a large baby at birth, jaundice, breathing difficulties, low blood glucose levels and low blood calcium levels when baby is born. And that might mean any of these health problems may mean that baby might need to go to the neonatal unit whenever they are born. I am really aware that this can be quite frightening and quite scary to hear all of these risks of gestational diabetes. But what we do know is that the majority of women go on to have healthy babies and healthy pregnancies. It just takes more careful care and management of their gestational diabetes. And we're going to go through the steps that we would recommend you to follow in terms of helping you manage your gestational diabetes going forward. So the treatment plan for gestational diabetes is firstly, making careful food choices. Secondly, engaging in physical activity if possible. And lastly, monitoring your blood glucose levels. So for the majority of women who are diagnosed with gestational diabetes, roughly 8 out of 10 women with gestational diabetes, they will be able to manage it solely by making careful food choices, doing some physical activity and monitoring the blood glucose levels. A smaller minority of women then, they may need medication as well. But everyone starts out on the same path, making careful food choices, doing exercise and monitoring the blood glucose levels. And then as the weeks of pregnancy go on, and when you're linked in with the midwives for your phone call appointments, medication may be considered more then in the future. But for today's session, we're just going to focus on making careful food choices, physical activity, and monitoring the blood glucose levels in terms of your treatment plan or managing your gestational diabetes at present. So I want to let you know that all of the information around eating and drinking for gestational diabetes, physical activity and monitoring your blood glucose levels, all of that information is in this booklet called A Guide to Managing Your Gestational Diabetes. This booklet is available on the Rotunda website, but it's also available in your glucometer pack. So whenever you get your machine for checking your blood glucose levels, this booklet will be in there as well. So if we firstly look at physical activity and how you can use that to help manage your gestational diabetes. So if we think of physical activity in pregnancy, first off, it's recommended that women in pregnancy aim for roughly 150 minutes of activity per week. That might sound like quite a lot. We could break it down smaller into 30 minutes of activity 5 days per week, or we could break that down even smaller into 10 minutes of activity 3 times per day. If you're not already active, it may be more important that you would start gradually. or if you haven't been doing any exercise at all, it may be helpful to just get checked over by your GP or antenatal doctor to make sure that it's safe for you to begin doing exercise in pregnancy. And then if you're already active, we would encourage you to keep going. Many types of exercise are suitable. So it could be walking, it could be pregnancy yoga, it could be pregnancy Pilates, it could be swimming. Some women may still attend the gym. Whichever exercise you do, just make sure that you always protect your bump or your tummy. That's super important. And then if you do think you need to just check out with your GP or your antenatal doctor around exercise or activity, that's okay as well. We did decide to put some exercise videos up on the Rotunda website, so you can see them here, exercise for gestational diabetes. And there also are some exercise videos on the YouTube channel called The Bump Room. And these exercise videos were made by physiotherapists, so they're suitable for use in pregnancy. The reason we pop these up here is because some women may find that they can't get out for a walk because it's too icy outside, or maybe they have other children to mind at home and it's not suitable to go outside. So we just thought it might be helpful to put some exercise videos that you could do in the home up there as well. Then if we think of exercise and gestational diabetes, so how can exercise help with my blood glucose levels and my gestational diabetes? So what we know is that whenever we do exercise, we're using up energy and it can help to lower or bring down your blood glucose levels. The best time to do exercise for your gestational diabetes is after your meal. Typically we would explain roughly doing 10 to 15 minutes of exercise after breakfast or lunch or dinner meal. That can really help with your post-meal blood glucose level. Some women decide to do 10 minutes of exercise after breakfast, lunch and dinner. If they can do that, that's great. Some women that may not be practical for you and you might be only able to do it at one meal throughout the day, doing exercise afterwards. Or for some women, it may not work doing it after meals straight away. So it might be doing exercise at another time of the day, and that's also fine. So I suppose the most opportune times to help with your blood glucose levels though is to do exercise after you've eaten your meal for like 10 or 15 minutes or longer if you're able. And then the other time that could be helpful to do exercise is in the evening time. So in between evening meal and going to sleep, doing some exercise in there, that can really help with your next morning blood glucose levels as well. So hopefully you've got some helpful information there in terms of exercise and gestational diabetes and knowing how it can help you to bring down your blood glucose levels. What we're going to move on to talking about next is your food choices. So whenever we think of gestational diabetes, what I want you to know is that there are some foods that will affect your blood glucose levels, and then there are other foods that will have no effect on your blood glucose levels. And we're going to talk all about them today and explain what foods we recommend you to eat, what foods we would recommend you to avoid. So whenever we think of diabetes, the food group that will affect your blood glucose levels is known as carbohydrates. You may have heard of carbohydrates before, and you may not have, and that's okay. What I want you to know about carbohydrates is that when we eat them, they go down into our tummy and we digest them. They break down into sugar or glucose, and therefore they're going to affect your blood glucose levels or your blood sugar levels. What's really important to know about carbohydrates though as well is that we still need you to eat them every day going forward in pregnancy, because carbohydrates provide mum with energy and fuel to support pregnancy. And carbohydrates are also essential for babies so that baby can grow properly and fuel baby's growth as well. So what we're going to look at next is what types of carbohydrates are still okay to eat and what carbohydrates will be recommended to limit or avoid. So if you look here in this column, you can see starchy carbohydrates like bread, cereal, rice, potato, yam, cassava, plantain, pasta, crackers. These are the carbohydrates that we would still recommend you to eat every day in pregnancy because they contain essential nutrients for pregnancy. They will cause your blood glucose levels to go up, but we still want you to eat them every day in pregnancy because mum and baby need them for their essential nutrients. The next group on the list is your natural sugars. So that's things like fruit and milk and yogurt. And we still want you to eat these every day in pregnancy because they also contain essential nutrients for pregnancy for mum and baby. These foods will also still cause the blood glucose levels to go up, but we still need you to eat them because they contain those essential nutrients for pregnancy. Then you can see the last column here, we have free sugars. So that includes things like honey, syrup, soft drinks, smoothies, fruit juice, confectionery like biscuits, cakes, sweets, chocolates. These are the types of carbohydrate foods that we would recommend you to limit or avoid, because whenever we eat these foods, they spike up our blood glucose levels very, very high. And also, they don't contain any essential nutrients for pregnancy. So mum and baby don't need these foods to support pregnancy. So we're recommending you to avoid the free sugars like honey, syrup, soft drinks, smoothies, fruit juice, confectionery. To talk a little bit more about carbohydrates and your blood glucose levels, I do want to remind you that eating carbohydrates is an essential part of a healthy diet in pregnancy. So you still need to include carbohydrates every day going forward in pregnancy. We just need to look more carefully at what types of carbohydrates and what times to eat them and what amount, for example. So we're going to go through the key steps to managing your carbohydrates to help you manage your blood glucose levels and your gestational diabetes overall. So the first step will be eating regular meals and snacks that contain carbohydrates. Secondly, choosing the right type of carbohydrate foods. And thirdly, eating the recommended carbohydrate portion size. So a really important part of your plan with gestational diabetes is eating regular meals and snacks with some carbohydrates. So if you look at this image on the top half of the screen here, we can see this is someone's blood glucose level when they were eating one large meal and with too much carbohydrates. So we can see this person here, this is their blood glucose level. We can see it spiked up quite high here. And what has happened is they left it quite a long time throughout the day before they ate a meal. They probably got quite hungry and had a really large meal with too much carbohydrates, like a spaghetti bolognese and garlic bread, for example, and that spiked up the blood glucose levels very, very high. Then if we look in opposition, so the opposite of that nearly, is that this picture on the bottom half of the screen, we can see this is someone's blood glucose levels when they were eating regular meals without too much or too little carbohydrates, so just the right amount of carbohydrates. And we can see that they have a lot better blood glucose level control over the course of the day. So what we're encouraging you to do is eat regular meals. So we would encourage you to have a breakfast meal, a lunch meal and a dinner meal every day. And at those times that you would have a more moderate portion of carbohydrates. And I'll explain that more as we go through today's session. In between those meals, we would recommend that you have a small snack between breakfast and lunch, then that you would have another small snack between lunch and dinner, and then you would have another small snack in the evening time. In terms of timing of the meals, we would encourage you to maybe have no longer of a gap than 5 to 6 hours between breakfast and lunch, 5 to 6 hours between lunch and dinner. Then in the evening time, we would encourage you to try and have your evening meal not too late. As a general guide, we would kind of say around 7:30 or 8 p.m. at the latest for your evening meal. But what you might notice is that maybe you might be thinking, that's not going to work for me. I normally have my evening meal around 9 p.m. What we've noticed is if you have, and what kind of the evidence shows, is that if you have your evening meal very late, it can cause your next morning blood glucose level to be high. So what you might decide to do is continue with your evening meal at the time it's at the moment. But if you see that it's causing the next morning blood glucose level to be high, you might need to bring back your evening meal earlier and see if that helps improve that next morning blood glucose level then. And then we do encourage you to have a small snack in the hour or two before going to sleep to help with the next morning blood glucose levels. So to explain that a little bit more, so say for example you had your evening meal at 7:30 and then the next morning you didn't have breakfast until 9 a.m. Excuse me, that's a really long time fasting overnight. That's greater than 12 hours. And oftentimes if we have a prolonged fast overnight for greater than 8 to 10 hours, that can actually cause our next morning blood glucose level to be higher. So we encourage you to have a small snack before going to bed. So say in this case, this person might have had a snack maybe at 10 p.m. in the hour before going to bed, and then they had breakfast the next morning at 9 a.m. So they had a shorter fast, maybe not where we want it to be, but it's definitely a shorter fast, and which may help with those next morning blood glucose levels then as well. The second thing that we're going to look at is choosing slow releasing carbohydrate foods. So earlier I explained what foods contain carbohydrates, and now we're going to split them down even further into slow releasing carbohydrate foods and fast releasing carbohydrate foods. What I want you to take away from this slide is that going forward in pregnancy with gestational diabetes, we're encouraging you to choose the slow releasing carbohydrate foods, because what happens is whenever we eat slow releasing carbohydrate foods, the glucose is released more slowly in our body. So these foods are digested more slowly in your body. The glucose is released more slowly, and therefore they only gently rise your blood glucose levels. So that would be things like whole grain bread, Ribena crackers, shredded wheat, or pears, for example. These foods are typically higher in fiber and less processed, and therefore they work better with the blood glucose levels. So we're encouraging you to choose these types of carbohydrate foods. On the right-hand side of the screen then, we can see the term fast-releasing carbohydrate foods. So what that means is whenever we eat these foods, we digest them really quickly in our body, and the glucose is released really, really quickly and can spike up our blood glucose levels very, very easily. So we're encouraging you to limit or avoid these foods because we know they're going to spike up the blood sugar levels very, very easily. Fast-releasing carbohydrate foods are usually quite refined, they're low in fiber, and they may be quite processed with added sugars, and therefore they can spike up the blood sugar levels very quickly and very easily. So that would be things like white bread or cream crackers or cornflakes or bananas. These would be the types of carbohydrate foods to limit or avoid. So in the gestational diabetes booklet that I mentioned earlier, you will see a page that looks like this. It's actually on page 6 of your gestational diabetes booklet, and it shows you the better types of carbohydrate foods to go for. We would encourage you to try choose these carbohydrate foods at most of your meals, because we know that they work the best with your blood glucose levels. Then on page 7 of the gestational diabetes booklet, it shows you the carbohydrate foods that we would recommend you to limit or avoid, because we know they spike up the blood glucose levels very, very easily. So in general, you're going to try and limit or avoid these carbohydrate foods here on this list. I'm going to go back and briefly talk you through these two lists. So whenever we think of bread, I want us to let you know that bread is a carbohydrate food. It will affect the blood glucose levels. But now when you're choosing bread, we're going to encourage you to try and choose the better type. So if you're in the shop wondering what type of bread should I go for, then we would be encouraging you to go for whole grain bread or multi-seed bread or stone ground bread, rye, low GI or sourdough breads. And what you're aiming for in those breads is that they have less than 15 grams of carbohydrate per slice of bread. So you might need to check the back of the packet and make sure that it has less than 15 grams of carbohydrate per slice of bread. If you eat things like pita breads or chapati or roti, we would encourage you to choose ones made from chickpea flour or whole wheat flour, or maybe you prefer wraps, and we would just encourage you to choose wholemeal or seeded tortilla wraps. And then the types of bread that we would recommend you to limit or avoid would be any white bread, wholemeal breads, thick cut bread, doorstep breads, white bagels, bread rolls, white chapati, white panini, because we know these types of bread are going to spike up the blood sugar levels very, very high, very easily. The next group on the list is cereals. So the cereals that we know have worked best with the blood glucose levels are things like jumbo porridge oats, all bran sticks, or shredded wheat. But some women have noticed that even these breakfast cereals still cause their blood glucose levels to go up high. So some women have noted that breakfast cereals just don't really work for them with gestational diabetes, but these would be the best 3 to try. Other breakfast cereals, like for example muesli or Weetabix or Shreddy or Cocoa Pops or cornflakes, Rice Krispies, granola, Special K. Unfortunately, these breakfast cereals are notorious for spiking or raising up the blood glucose levels, so we would encourage you to limit or avoid them in pregnancy with gestational diabetes. Some of these cereals are absolutely fine and healthy outside of pregnancy, but with gestational diabetes, they just don't work well with the blood sugar levels and tend to spike them up quite high quite easily. Next, I'm going to move on to grains. So that's things like pasta, rice, noodles, for example. For pasta, both white pasta or brown pasta, either is fine to use. If you're going to have noodles, we'd encourage you to go for egg noodles instead of rice noodles. If you're going for rice, we would encourage you to go for white basmati rice or brown rice instead of jasmine rice or long grain rice or Indian rice, for example. And then also just to let you know that whole barley, quinoa and wholemeal couscous are also okay as well. The type of grains that we would recommend you to limit or avoid are any easy cook rice or long grain rice or jasmine rice. or any rice noodles or instant noodles like pot noodles, for example. The next group on the list is potatoes. So we eat lots of potatoes here in Ireland. So whenever we're trying to choose potatoes for gestational diabetes, what we would encourage you to do is choose potatoes with the skin on. So it could be baby potatoes with the skin on or regular potato with the skin on. That's absolutely fine. Sweet potatoes, yam, cassava are also okay. The types of potato that we would recommend you to limit and avoid though are things like mashed potato, chips, potato croquettes and waffles. Because they're more processed or refined, they tend to spike up the blood glucose levels very easily. I'm going to come back to snacks in just a second. I'm going to talk a little bit about fruit first. So this often surprises women. So the better types of fruits to choose with gestational diabetes are things like apples, pears, peaches, plums, berries, kiwis, oranges. These are the better types of fruits to go for. And then the types of fruits that we would recommend you to limit or avoid are things like bananas, grapes, mango, pineapple, melon, fruit juices, dried fruits, smoothies, or tinned fruits and syrups, because these fruits will really easily spike up the blood glucose levels. And so we would encourage you to limit or avoid those ones. Then for milk and yogurt, so lots of women ask me, is milk still okay? So milk will affect the blood glucose levels. All these foods on this screen will affect the blood glucose levels still, but we're encouraging you to choose the better options of those. So for milk, full fat milk, low fat milk, skimmed milk, all are fine. Then we would encourage you to avoid any like chocolate flavored milks or strawberry milks, because we know that they have added sugars in them. You might be wondering, I take oat milk or soy milk or nut milks, for example. What about those? So if you're taking milk alternatives, we would encourage you to choose one that has no added sugar. And then if you check the back of the packet to ensure that it has less than 5 grams of total carbohydrate per 100 ml or less, that would mean it's suitable for use with gestational diabetes. And then you might be wondering, what about yogurts? So the better types of yogurts to go for with gestational diabetes would maybe be like plain, Greek or natural yogurts. And then if you wanted a flavoured yogurt, we would encourage you to go for one that is either diet or no added sugar. For example, the Danone Activia 0%, or the Muller Light yogurts, or the Irish Diet yogurts. And what you would be aiming for is in that yogurt is that it has less than 12 grams of carbohydrate per serving. So if you choose a yogurt that's not one of the ones listed here, we would recommend that you check the back of the packet and make sure that it has less than 12 grams of carbohydrate per serving. Then the type of like yogurts to avoid would be any yogurts with fruit compote or added sugar, or any like chocolate mousses or dessert style yogurts. We would be recommending you to avoid those. Just to touch on snacks, so the snacks that we would recommend you to limit or avoid would be things like cream crackers or cakes or biscuits or cereal bars or rice cakes or corn snacks, because we know they'll digest really quickly in your body and spike up the blood sugar levels very easily. But what I do want to do is show you some suitable snack options instead. So it could be things like Revita crackers instead of cream crackers. It could be oat cakes instead of cream crackers. It could be popcorn. It could be a piece of fruit. It could be a yogurt or a glass of milk or a latte or cappuccino, for example. They would all be suitable snack options, but I will go through and touch more on snacks later. And then lastly, there's just some miscellaneous foods that women maybe don't realise will raise up their blood glucose levels. So it could be any breaded or battered meat or fish or chicken, pastries, pizzas, Yorkshire puddings, or any ready-made sauces with added sugar. We would recommend you to limit or avoid these, because we know they'll spike the blood glucose levels up very easily. I thought it might be helpful to just show you some examples of suitable bread options. So this is the McCambridge's whole wheat bread, the high fibre bread from Lidl or Aldi, the Brennan's whole grain chia bread, the Johnson, Mooney and O'Brien Greek greens bread. But all of these breads have in common is they have less than 15 grams of carbohydrate per slice. The breads on the bottom half of the screen, like white bread, thick cut bread, doorstep breads and wholemeal breads, we would be recommending that you limit or avoid these ones, because we know that there's too much carbohydrates in them, or they'll spike the blood glucose levels up very high very easily. For some women, they might need a lower carbohydrate bread option for breakfast time. Breakfast can be a tricky time of day to manage the blood glucose levels, and carbohydrates may be poorly tolerated at breakfast time due to the pregnancy hormones and the morning hormones in your body. So if you find that your blood glucose levels are going high after breakfast, what might be helpful to do is trial one of these lower carbohydrate bread options instead. So it could be 2 slices of the whole grain Brennan's Be Good bread, one of the Fitzgerald's multi-seed bagel slims, or one of the Irish fried slimsters, along with some protein and some vegetables. These are just some examples of suitable yogurt options. So it could be the Danone Activia 0%, no added sugar yogurts, the Irish Diet yogurts, the Alpro no added sugar yogurts, Glennis natural yogurt, and the Muller Light 0% added sugar yogurts, or the Glennis protein yogurts. All of these are suitable for use with gestational diabetes. But as I said earlier, if you picked up a different yogurt and you wanted to know is it suitable, what you're going to do is you're going to check the label and see per serving, so per small pot, so usually 125 grams or 150 grams, and you're going to look and see does it have less than 12 grams of carbohydrate per pot. So we can see in this strawberry no added sugar yogurt on the label, the amount of carbohydrates per serving is 7.6, so that means it's suitable for use with gestational diabetes. If this number was above 12, it wouldn't be suitable for use with gestational diabetes. Just some additional notes on fruit and vegetables. So earlier I mentioned that it's better to choose these types of fruits because they work better with the blood glucose level. So apples, pears, oranges, plums, mandarins, kiwis, berries, for example. If you are, or when you are choosing these fruits, we would encourage you just to have one portion at a time. So like an apple or an orange rather than both together. And if you are having a portion of fruit, we would encourage you to add some protein along with it. So maybe some nuts or some nut butter or cheese along with your piece of fruit, because that will just help balance the blood glucose levels a little bit better as well. And just a reminder, the fruits to avoid would be things like bananas, grapes, juices, smoothies, dried fruits like raisins, dates, figs, prunes, and any exotic fruits, as they will raise the blood sugar levels very easily. I just want to touch a little bit on vegetables then. So just to highlight firstly that the majority of vegetables will not affect the blood glucose levels. But there is one exception, and that's beans, peas and lentils, because they do contain some carbohydrates. So whenever you eat beans, peas and lentils, they will cause the blood sugar levels to go up, but it's still absolutely fine to eat beans, peas and lentils because the glucose, because they're digested very slowly in your body, and the glucose is released very slowly as well. We would explain though, if you are including more than half a cup of beans or peas or lentils in your meal, you might need to have a slightly smaller portion of starchy carbs on your plate. So for example, today if you had chicken curry and rice, and that was fine, no problem. Then tomorrow you had chickpea curry and rice, you might need to have a slightly smaller portion of rice tomorrow because there's also carbohydrates in your chickpeas as well. I thought this slide would just be helpful to remind you to avoid foods that are really high in sugar. So things like honey or syrups, any table sugar like brown sugar or white sugar, soft drinks, biscuits, cakes, sweets, confectionery, pastries, alcohol-free drinks, or any fruit juice or smoothies, because these will really spike up the blood sugar levels very, very high, very easily. If you wanted some lower low sugar or sugar-free options, it might be looking at things like no added sugar squashes. If you wanted an alternative for like your sugar, for example, you could go for things like artificial sweeteners like Splenda or Canderel. Instead of things like full sugar soft drinks, you could go for the free versions. So it could be like 7-Up Free or Coke Zero, for example. And then also just a reminder that some medications will contain sugar as well. So it's helpful to maybe check with your pharmacist if you are taking medication that it is sugar-free or that you're getting the sugar-free option. So a simple explanation would be if you're taking Gaviscon or Rennie for heartburn or reflux in pregnancy, it's important that you would choose the sugar-free version of those, because some of the other ones do contain sugar and they're going to push the blood sugar levels up if they do. Similarly, maybe if you have a sore throat, for example, you might decide to take Strepsils. It's important to get the ones that are diabetes friendly or sugar free. And I thought it might also be helpful to show you some examples of sometimes foods that are more kind of sweet options that you could have occasionally. So it could be one of the Kind bars, it could be 2 of the Nairns unsweetened oat biscuits, one of the Nature Valley protein bars, one of the Fibre One bars, or 4 squares of dark chocolate and some nuts. So I talked a lot about carbohydrate foods because they affect your blood glucose levels, and I've explained that you still need to eat some of them, and then there's other carbohydrate foods that you will need to avoid. What I want to show you next is that there are foods that do not contain carbohydrates, and they're listed on the screen at the moment. What I want you to know about these foods is they will not affect your blood glucose levels. So you can eat these foods on the screen at any time of the day and they will not affect your blood glucose level numbers or readings. So for example, fat-based foods like butter, oil, pesto, mayonnaise, they will not affect your blood glucose levels. The next food on the list are protein foods like fish, meat, cheese, nuts and eggs. They also will not affect the blood glucose levels. And then also lastly is your vegetables and salads. So we also know that these will not affect the blood glucose levels either. These foods do not contain any carbohydrates and therefore they will not affect the blood glucose levels. So you can eat them at any time of the day and they won't affect the blood glucose levels. The third thing then that we're going to look at in terms of carbohydrates today is how much carbohydrates can I have? So how much bread can I have? How much rice can I have? How much milk or fruit can I have, for example? In your gestational diabetes booklet on page 9, it does go through your carbohydrate portion sizes. So after today's session, it may be helpful to go back and use this as a point of reference whenever you're looking at measuring out your portion sizes of carbs for your meals and snacks as well. So I'm going to explain that we're going to use the term carbohydrate choices to help you understand how much carbohydrates to have at your meals and snacks. So one carbohydrate choice contains 10 to 15 grams of carbohydrates. As a guide, most women will need to eat 1 to 2 carbohydrate choices at breakfast, 3 to 4 carbohydrate choices at lunch and at dinner, and 1 carbohydrate choice at snack times. So you might be wondering, what does 1 carbohydrate choice look like? So 1 carbohydrate choice could be 1 slice of whole grain bread, or 2 Velveeta crackers, or half a tortilla wrap, or half a chapati, or 50 grams of cooked basmati rice, or 50 grams of cooked pasta, or 1 glass of milk, or 1 pot of yogurt, or 1 shredded wheat, or 20 grams of jumbo oats, 40 grams of all bran sticks, 100 grams of potatoes boiled, 1 medium fruit, or 2 small fruits, or 1 cup or handful of berries. So each image on the screen here represents 1 carbohydrate choice. Then if we go back to the slide before, if you think at breakfast time, the maximum you can have is 2 carbohydrate choices at breakfast. So that means you could have 1 slice of bread and a glass of milk. That would give you 2 carbohydrate choices. And then you could put your protein foods like egg and meat and cheese and nuts and salad along with your carbohydrate choices as well. So another example could be at lunchtime, maybe you decide, okay, I'm going to go for 3 carbohydrate choices at lunch. So that means you can choose 3 options from this slide. So you might decide to have a sandwich. So 2 slices of bread is 2 carbohydrate choices. And then afterwards, you might decide to have a piece of fruit. That's your 3rd carbohydrate choice. And then you would have your protein and vegetables as your filler in your sandwich. And there'd be no carbohydrate choices there, and because they are carbohydrate-free foods. Another example maybe for dinner. So maybe at dinner time, you decided to go for 4 carbohydrate choices at dinner. So you might decide to have a chicken curry and rice. So the chicken and vegetables, there'd be no carbohydrates in that. And then if we think you're going to have 4 carbohydrate choices for your evening meal. So we know that 50 grams of cooked basmati rice is 1 carbohydrate choice. So that would mean that 200 grams of cooked basmati rice give you your 4 carbohydrate choices. I want to highlight, just in case anyone who is watching the recording session, if you have had bariatric or weight loss surgery in the past, the amount of carbohydrate foods that you will be able to eat will likely be very different, but you will get an individual appointment with the dietitian and to discuss this further. So kind of just do your best with what you can manage, and then you can discuss it further with your dietitian at your phone call review or appointment as well. I thought it might be helpful to show you some examples of what 2 carbohydrate choices look like. So we have 1 large whole meal pita bread, 2 slices of brown bread, 1 large wholemeal tortilla wrap, 1 medium-sized chapati, 100 grams of cooked basmati rice, 100 grams of cooked pasta, 100 grams of egg noodles, 5 or 6 baby boiled potatoes, this amount of yam, plantain, or sweet potato. It may be helpful, or it will be helpful actually, maybe to decide what way you're going to measure your carbohydrates out. So the booklet that I showed you earlier is really helpful, and it shows you in terms of grams. So if you weigh out your food, how much carbohydrates or how much food you should be weighing out for the amount of carbohydrates you can have. So for some women, they opt for using a kitchen scales at home, and that's what works best for them. Other women might not have a kitchen scales at home or might not be open to weighing out their food. So it might be helpful to choose another way of estimating your carbohydrate portions. So some women have decided to use like a cup measure, this, or using 1 fistful, or using 1/4 of their plate as a measure. Because what we roughly know is that 1 cup or 1 fistful or 1/4 of your plate covered in cooked rice or cooked pasta or cooked egg noodles equals to roughly 2 carbohydrate choices. So like for example, a 200 ml cup filled with cooked rice, that would roughly equal to 200 or would be equal to roughly 2 carbohydrate choices. Or 1 fistful of cooked rice would equal to roughly 2 carbohydrate choices. I'm just going to go back over that. So just to let you know that I suppose 1 cup or 1 fistful or 1/4 of your plate covered in cooked rice or cooked pasta or cooked egg noodles, that would roughly equal to around 2 carbohydrate choices. And then, so for example, a 200 ml cup filled with cooked rice, that would roughly equal to 2 carbohydrate choices. Or 1 fistful of cooked pasta, that would roughly equal to 2 carbohydrate choices. What we've covered so far today is we've looked at the importance of activity in managing the blood glucose levels, thinking about carbohydrates, so which foods contain carbohydrates, the importance of eating regular meals and snacks, choosing the right type of carbohydrate foods, watching your carbohydrate portion size, and next we're going to look at putting meals and snacks together. So say for example, when you go to make your next meal, the first thing that we want you to think about is, am I choosing the slow releasing carbohydrates that are outlined on page 6 of my booklet? Once you've identified a slow releasing carbohydrate food that you're going to opt for, the next thing you would need to think about is, am I choosing the right amount of carbohydrates for this meal or for this snack? So as a reminder, most women need to eat 1 or 2 carbohydrate choices at breakfast, 3 to 4 choices at lunch and dinner, and 1 carbohydrate choice at snack times. And then to balance your meal to help give you better blood glucose levels, we would encourage you to add in protein along with your carbohydrates. That would be maybe adding in some meat or chicken or eggs or tofu or corn, adding in some healthy fats like olive oil or rapeseed oil or avocado or pesto or spreads, and then also adding in your fiber like whole grains, nuts, seeds and vegetables, for example, alongside your carbohydrate foods as well. And then do know that it is still absolutely fine to add in herbs and spices. And similarly, you can still add in things like tomato puree, passata, tinned tomatoes, no salt stock cubes, soy sauce. They're all absolutely fine to use. Then I thought you might find it helpful if we went through kind of a sample meal plan. So you can see breakfast examples on the screen here, and each example here on the screen has estimated roughly 2 carbohydrate choices. So the first example is 2 slices of whole grain toast, an egg or cheese and salad. Another option could be 1 slice of whole grain toast and 1 pot of diet yogurt. Another example could be 1 slice of whole grain toast and 100 grams of low sugar baked beans. Or you might decide to go for a suitable breakfast cereal option. So it could be 1 shredded wheat with 150 to 200 ml milk. Or it could be 30 to 40 grams of all bran sticks with 150 to 200 ml milk. Or it could be 40 grams of jumbo porridge oats made on water and a boiled egg to give some protein. Or it could be 30 grams of porridge oats made with 200 ml of milk. Or maybe you might decide to go for a completely different type of food because that's what your culture does. So you might decide to go for 100 grams of cooked basmati rice and maybe some vegetable curry or meat curry. Or you might decide to go for 2 small whole wheat chapati, 60 gram in weight, and then meat and vegetable curry as well. Then these are just some examples for lunch and dinner, which contain 3 carbohydrate choices. So we can see the first meal here is a sandwich and piece of fruit, and it has 3 carbohydrate choices because each slice of bread is 1 carbohydrate choice, and then your piece of fruit is your 3rd carbohydrate choice. Then another example in the middle of the screen, we can see this person has 200 grams of cooked potatoes. That's 2 carbohydrate choices, protein, salad, and their glass of milk gives them the 3rd carbohydrate choice. And then the 3rd meal on the screen, this person has had like chili con carne and rice and salad, and they've got all of their carbs from rice. So 150 grams of cooked rice, that gives them 3 carbohydrate choices. Some other examples of what 3 carbohydrate choices might look like. So this is spaghetti bolognese. So they've had their meat with their minced meat. And then they've also had 150 grams of cooked pasta, which would be 3 carbohydrate choices. Or this person has had like an egg noodle, and chicken and vegetable stir fry. And so 150 grams of egg noodles is 3 carbohydrate choices, and they've had their protein and vegetables along with it. And then in the bottom right hand corner here, we can see this person has had like a vegetable curry, so no carbs there. And then they've had 1/4 of their plate covered in cooked rice. That's roughly 2 carbohydrate choices. And then they've had a pot of yogurt or curd, which would give them another carbohydrate choice. So in total, 3 carbohydrate choices for this meal as well. Earlier, I mentioned that we encourage you to have a small snack between breakfast and lunch, another snack between lunch and dinner, and then a small snack in the evening time. It's really important that you would keep your snacks in line with the gestational diabetes recommendations. So what I mean by that is that each snack would contain only 10 to 15 grams of carbohydrates, and that they would have a little bit of protein as well. So for example, it could be a pot of diet yogurt, or it could be a glass of milk, or it could be plain or Greek yogurt and some berries, or it could be 2 Ribena crackers and some vegetables and hummus, or it could be 2 oat cakes and vegetables and hummus. I'm just going to start that side again. So earlier I mentioned that it's important for you to have a snack between breakfast and lunch, a small snack between lunch and dinner, and a small snack in the evening time. With gestational diabetes, it's really important that you would keep your snacks suitable for gestational diabetes. So what I mean by that is each snack would contain less than 10 to 15 grams of carbohydrates and a little bit of protein. So snack examples could be like a pot of diet yogurt, or a glass of milk, or plain or Greek yogurt and some berries, or 2 oat cakes and some vegetables and hummus, or 2 Ribena crackers and some cheese and tomato, or a small latte or cappuccino, or a small bag of popcorn and some nuts, or a slice of whole grain bread and egg and salad, or 2 of the Narns unsweetened oat biscuits, or 1 of the Kind bars, or maybe a piece of fruit and some nut butter or nuts. Very high carbohydrate meals then, unfortunately, things like pizza, full plates of pasta, full plates of rice, or garlic or naan bread, they just contain too much carbohydrates, and they're going to spike up our blood glucose levels very high, very easily. So we are encouraging you to avoid these. You can still eat pasta and rice, that's absolutely fine, but we would just recommend that the maximum portion size of those is half of your plate, because half of your plate covered in rice or pasta would equal the 4 carbohydrate portions or choices. On the Rotunda website, there is the Gestational Diabetes Cookbook that was created by the University College Cork, and it will give you some ideas for breakfast, lunch, dinner and snacks. If you would like them, you can scan the QR code here on the screen, and that will bring you directly to the cookbook. Next, what I'm just going to touch on is managing common issues with your gestational diabetes. So what you might notice is that you have high fasting levels before breakfast, or you might notice that you're having high levels after breakfast, or you're having high blood glucose levels after other meals, or that you're feeling hungry or are losing weight. If any of these issues crop up for you, what we would explain is maybe trialing the suggestions that are on the screen at the moment to see if they might help to bring down the blood glucose levels, or maybe help with your hunger or weight loss. If you've tried them, or if you've tried them and the blood glucose levels are still high, or you're still having the issue, do know that you can contact us, and your diabetes team will be there to support you with a plan to help you manage your blood glucose levels or help you manage that issue. And if you notice some of these issues coming up for you, what might be helpful is to check out page 12 of your gestational diabetes booklet, and it explains the suggestions of what you can trial to help with that issue. And if you're concerned before you get a chance to trial them, that's okay. You can always ring us. What can be helpful though is trialing the suggestions and then phoning us and explaining if they're working or not for you. Then next, what we're going to just chat through is what if I need extra supports with my diet. On the Rotunda website, you will find lots of resources available to help you to help support you with your diet for gestational diabetes. So there is the cookbook for gestational diabetes. There's also the booklet, A Guide to Managing Your Gestational Diabetes, which goes through all about food choices and physical activity. And then there's also some exercise videos, and there is a fake away recipe booklet as well. Our contact details are also available on the Rotunda website. They're also available on the screen at the moment, or they're on the front of your gestational diabetes booklet as well. I also want to highlight that if you are feeling particularly overwhelmed or worried or anxious about your diagnosis with gestational diabetes, we also have a mental health support team, and I've popped their contact detail on the screen here as well if you ever feel that you need to contact them as well. So then going forward, in terms of managing your gestational diabetes, we would encourage you to make the changes to your food and activity levels as needed. We also encourage you to take a daily pregnancy multivitamin if you're not doing so already. We would ask you to check and record your weight every 2 weeks. The reason for that is you're likely going to be making changes to your diet, and therefore it may have a knock-on effect on your weight, and we will just ask you to check your weight every 2 weeks and report to the midwife at your phone call reviews then as well. And then if you need any extra supports, you can link in with us if you need, but also thinking outside of yourself, what supports do you need to put in place for you at home or in work to help you manage your gestational diabetes going forward.
We have now moved on to the last section of the gestational diabetes class, and what we'll cover in this portion of the class is monitoring and follow-up care, what happens after your baby is born, ordering your glucometer pack, and setting up and using your glucometer machine. To ensure good management of your gestational diabetes, we ask you to monitor your blood glucose levels 4 times per day. You should test your blood glucose levels before your breakfast, exactly 1 hour after you finish eating your breakfast, 1 hour after finish eating your lunch meal, and 1 hour after you finish eating your dinner meal. You might be wondering then, what are the target values for your blood glucose levels? We aim for your blood glucose levels before breakfast to be less than 5.3 and after meals to be less than 7.8. If you have recently been diagnosed with gestational diabetes, you will need to check your blood glucose levels every day. So that means if you've had your glucose tolerance test in the last couple of days or weeks, then you should check your blood glucose levels every day. If you were diagnosed with gestational diabetes in a previous pregnancy, welcome back, and you will need to check your blood glucose levels only 2 days per week until you're 28 weeks pregnant. And then whenever you turn 28 weeks pregnant, you will be asked to start checking your blood glucose levels every day. As I mentioned earlier in the session, for the majority of you, making appropriate food choices, doing some physical activity, and regular monitoring of your blood glucose levels will be sufficient to manage your gestational diabetes and your blood glucose levels. However, for some women, no matter how closely you follow the diet or lifestyle advice, you may require additional help via medication to help manage your blood glucose levels. The medications that we use here in the Rotunda are safe for pregnancy, and one is a tablet form of medication called metformin, and the other is called an injection form known as insulin. I'm not going to talk any more about those today. However, do know that if you do need medication, that it will be discussed with you further at your telephone appointments that we will talk about in a little bit. So, as part of your care with gestational diabetes, you will be given an appointment for the Gestational Diabetes Virtual Clinic every 2 to 4 weeks. It will be every 2 weeks if you're checking your blood glucose levels every day, or it'll be every 4 weeks if you're checking your blood glucose levels only 2 days per week. What will happen for these virtual clinic appointments is that's where the midwife or member of the diabetes team will phone you to review your blood glucose levels and discuss them with you. Also, as part of your care with gestational diabetes, you'll be given an extra ultrasound scan whenever you're 32 weeks to 34 weeks, roughly in that period of pregnancy, to monitor your baby's growth. So it's an extra scan between 32 to 34 weeks to check in on baby's growth, because we know gestational diabetes can affect the growth of baby. Then also, it's important to know that if your diabetes is well managed after 36 weeks, you will be discharged from the, gestational diabetes phone call clinic or virtual clinic, but it is recommended that you should continue to follow the diet and lifestyle advice and continue testing your blood glucose levels until delivery of baby. You will also continue to attend your scheduled antenatal appointments as usual. And then if you have any concerns at any stage, you can always contact us, I suppose, if you're having any difficulties. So then you might be wondering, okay, well, what happens after my baby is born? So once your baby is born, you can stop checking the blood glucose levels. Do know that the midwives on the postnatal ward will monitor your baby's blood glucose levels for the first 24 hours after birth, and that's completely normal and standard care. We also highlight that it's very important to come back for your postnatal glucose tolerance test, which happens at least 6 weeks after your baby is born. And this is just to check and see that your blood glucose levels have returned to normal. Because having gestational diabetes puts you at increased risk of developing type 2 diabetes later in life. So we do ask you to come back to the hospital 6 weeks after baby is born to repeat the glucose tolerance test to see if the diabetes has gone away or if your blood glucose levels have returned to normal. In terms of your future health, because I did mention that you are at greater risk of developing type 2 diabetes later in life, it's important to know that you are able to avail of or entitled to avail of a free annual screening for type 2 diabetes, and that's both for public and private patients, and you can get that done every year. You just need to ask your GP and maybe also tell them that you had gestational diabetes to ensure that you get the free screening as well. To help prevent type 2 diabetes, it's known that following a healthy diet and engaging in physical activity can help can help you to reduce your chances of developing type 2 diabetes in the future. If you want more information on this, you can find a booklet on diabetes prevention on our website. And also then, just helpful to know, for any future pregnancies, you will be advised to start monitoring your blood glucose levels from your booking visit onwards. Having gestational diabetes in one pregnancy means that you're very likely, or 3 out of 4 times likely, to have gestational diabetes in your next pregnancy. So we just recommend here in the Rotunda that if you're pregnant again in the future, that you would start checking the blood glucose levels from 12 weeks onwards and linking in with the diabetes team then here as well. And then just to give you some information around breastfeeding, because we encourage breastfeeding for all women and babies. There is a special clinic known as the Wraparound Clinic for anyone who has experienced breastfeeding challenges in the past or has gestational diabetes. You can link into this clinic if you would like more information on breastfeeding. That's their phone number and their email address. The reason we encourage breastfeeding for women who have had gestation or have gestational diabetes is because we know that by breastfeeding after you've had gestational diabetes, it can actually help you reduce your chances of developing type 2 diabetes by around 50%. So that's why we encourage women who have had gestational diabetes to breastfeed. And then just some information on antenatal expression of colostrum. So what that means is, in the prenatal period before you have your baby, you can express colostrum from your breasts, and that means whenever baby is born, that it has nutrition readily available to be given to baby once they're born. And the reason why that can be helpful is if it's anticipated that baby might experience feeding difficulties when they're born, it's helpful to have colostrum available for baby to feed on. Or maybe if it's anticipated that baby might have difficulty maintaining their blood glucose levels after birth, which may be a risk after having gestational diabetes. So it's helpful to have colostrum readily available as well. Or I suppose also expressing colostrum means that your baby will have a supply of breast milk available if required, and therefore it reduces the need for our use of infant formula. If you want more information on colostrum harvesting or expression of colostrum, it's helpful to link in with the wraparound clinic. This is their email address and their phone number. There's also more information available on the Rotunda website. For the next part of the session, we're going to talk about how to order your glucometer machine and how to use it. So, whenever you were diagnosed with gestational diabetes or at your booking visit, the midwives would have taken some details from you, like your name, your date of birth, your PPS number, etc. And they would have collected these details and put them into a prescription. They would have sent this prescription to an online pharmacy that we use called the DTP pharmacy. This is an online pharmacy, and what this online pharmacy will do whenever they get that prescription from us is they will send you a text message that looks something very similar to what you can see on the screen here, and they will ask you to download their app, which is the DTP Solutions app. You will then use this app to order your glucometer machine. If you haven't received the text message like on the screen, that's okay. You can just download the app yourself. You can go into the Google Play Store or the App Store and you can download the DTP Solutions app on your phone, and you can put in your details, your name, your date of birth, your PPS number, and then you can order your glucometer machine from there. So once you've downloaded the app, put in your details, your home screen in the application will look something like this. Okay, so you will be able to see your name here, and then it will have a My Medicines drop down menu and Recent Orders drop down menu. Once you go in here first and you click into My Medicines, you might not have any items in here, and that's okay. Maybe check back in a few hours. It might just take them a little bit of time before they register you as a patient and get your prescription uploaded. So that might take a few hours. So maybe click back in later. And what you should see then is you should see your one touch lancets, your one touch strips, and there actually will be a third item, which is your glucometer machine. Um, and however many items there is, for some women you might only see 2 items, for other women you might see 3 items. It doesn't matter, just click them all. And what you need to do then is click order now and then click submit. Then it will ask you to pay for your machine. If you have a medical card, it will only cost you €3. If you do not have a medical card, it will cost you €80 to order your machine, your strips, and your lancets. Once you pay for your machine and your strips and your lancets, you will then be able to click when you would like it delivered to your home, and then that it will be I suppose delivered to your address that you have put in on the machine. If you have any difficulty with maybe the items appearing or maybe payment or it hasn't came, there is a little activity box here on the bottom of your app screen, and you can click in here and you can message them directly. You can message the DTP Solutions company, and they are very prompt in getting back to you, so they're really really helpful. And so if you have any difficulty, you can message them. If you're still not having any luck, please do contact the diabetes midwives or your diabetes team, and we'll hopefully be able to support you then to get your glucometer machine organised. Once you receive your glucometer pack, it will contain an owner's booklet and a glucometer machine booklet explaining how to use it. You will also get 400 test strips, 200 lancets, a quick start guide showing you how to quickly set up your glucometer machine and use it. You will also get a guide explaining how to check your blood glucose levels. You will get a booklet explaining around eating and drinking with gestational diabetes and how to manage your gestational diabetes. And then you will also get an information booklet on how to set up the Run Touch Reveal mobile application, and I'll talk about that separately after. If you need to order extra strips or needles, you need to go to the DTP Solutions webpage, so their website, to order more strips or needles. That's only if you need to. If you have any questions around that, I would recommend linking in with the diabetes team if you have any questions around ordering more strips or needles. Then once you get your machine, you might be wondering, okay, how do I set it up? So the first thing you need to do with your glucometer machine is you need to turn it on. So you just hold in the OK button on the right hand side, and then it's going to ask you to input a few things. So you need to set the language. Just select no when it asks you to download the One Touch Reveal app. Then you need to set the date and time. Then you need to set the pregnancy blood glucose level ranges. So before meal, it will be 3.5 to 5.2. And then after meal, it's 3.5 to 7.7. And then you will set the test tracker to 4 times per day. And then whenever you do check your blood glucose level, it is important that you tag the test result as either before or after meal. So if it's the blood sugar level that you've checked in the morning time before breakfast, that's a before meal blood glucose level check. And then if it's your after meal, you need to tag it as an after meal blood glucose level check. Then we also will ask you to set up the One Touch Reveal mobile application after setting up your meter. So how do you do that? So what you would need to do first is download the One Touch Reveal app, and you need to sign in with the same name you've used here in the Rotunda. Then use the blood glucose level ranges that are the same as over here, the pregnancy blood glucose level ranges, input them into your mobile app as well. Then to ensure that we can see your blood glucose levels here in the Rotunda, we would ask you to click this button on Android or this button on iPhone in your application, click connections, and then add our clinic code, which is JYHCEE. And what that means is you can see your blood glucose levels then on your phone when you check them, but we can also see them here in the Rotunda whenever you sync them with your mobile app. And also, just a reminder that many things can affect your blood glucose levels. So, food, activity, being unwell, stress, nausea, vomiting can all affect your blood glucose levels. So, if you do note that you are having high blood glucose levels, you can add a note in the phone application and write in what you think caused the blood glucose level to go high. And that can be really helpful then for whenever the midwives are phoning you or the nurses are phoning you for your virtual telephone calls as well. There is a quick start guide that comes with your glucometer pack, and it just shows you simple steps in terms of how to set up your glucometer machine, and then it also explains how to take a test. But also on the Rotunda website and on YouTube, there is video links showing you how to set up your glucometer machine and also how to take a blood glucose level test. Lots of women always ask about the little needles, they're called lancets, and how often do they need to change them. So here in the Rotunda, we recommend that you use one lancet per day and then dispose of it at the end of the day and then use a new lancet the next day. Just in case anyone else ever checks their blood glucose levels with your meter, it is important that they would use a clean sterile needle. And then when you go to check your blood glucose levels again, you would get a new needle then again. And that's just to prevent any cross contamination, which would be dangerous for you and for your baby. So always use a clean sterile needle for yourself, and you can use one per day. You might actually wonder then, how do I dispose of those needles? So we would say at the end of the day, once you've used it all day, you can then put it in an old jam jar or an old lunchbox. And once that box is full or once that jar is full, you can bring it back to the Rotunda and we will dispose of them in our sharps bin here in the Rotunda. As I mentioned earlier, so once you have your glucometer machine set up and you have your One Touch Reveal mobile app set up as well, it is important that you start checking the blood sugar levels the 4 times per day. But whenever you're checking the blood sugar levels, it's equally important that you tag the blood glucose levels correctly. So if the blood glucose level is before meal, you need to click before, or if it's after meal, you need to click after meal. And then if the test result is higher than the target value, we would recommend that you add a note writing in what you think might have caused the blood glucose level to go high. If you're wondering how do I tag the blood glucose level correctly, how do I do that? So once you check your blood glucose level and you see the result come up on the screen, what you can do is just click this back arrow button and then it will ask you to tag the blood glucose level as before or after, and that will allow you to tag it correctly then. And then if the blood glucose level is high, we would ask you to document in here in your app, click add a note feature, and then you can type in what you think caused it to go high. Other than that, thank you very much for taking the time to listen to the Gestational Diabetes Lifestyle class recording. And if you have any difficulties, do know that you can contact us in the coming days or weeks as you need, and then you will have your scheduled follow up appointments with a member of the diabetes team in the coming weeks as well.